Hello, everyone. My name is Karshe Yusuf, and I'm presenting outcomes of hide foot nail as a primary fixation modality in unstable ankle fractures in elderly. This is a study that we did that's based on short-term results, and we're going to discuss on the outcomes and what we think could be the benefits of this procedure. So as a basic introduction, we know that ankle fractures are one of the most common fractures in the elderly population. In fact, in all populations, but also in the elderly. Usually the conventional treatment for ankle fractures is open reduction internal fixation based on the stability of the fracture. However, it has been shown that, especially in the elderly age group, that there's been significant high rates of complications of open reduction internal fixation. In fact, the postoperative complications is about 4 times as high as in open reductions and internal fixation versus the Tibiotalocalcaneal nail. There's been some literature and some studies that have been carried out to show that, and this is mostly due to the multiple comorbidities, the osteoporotic bones, and as well as the skin conditions usually in this elderly age group. So the study that we did, basically, we gathered patient data that was collected from an online database of those that underwent the retrograde tibiotalocalcaneal nail. And these are the patients that had the operation for an unstable ankle fracture. And then retrospectively collected this data and conducted some interviews on these patients in terms of the outcome and whether there has been any complications with this particular group of patients. So the procedure involved close reduction under image intensifier, and the operation was done minimally invasive fixation with the guidance jig. No prior preparation of the ankle or subtalar joints were done. The patient literally comes in with a fracture, and they're identified to have osteoporotic bone and would benefit from a tibiotalocalcaneal nail, and the procedure went ahead. Postoperatively, these patients were placed in a boot and were allowed to fully weight bear in 2 weeks after the procedure. There was no cost, but the patient obviously would be given VT prophylaxis within those 2 weeks and then allowed to weight bear as soon as possible. This is in contrast to the patients that would normally get an open reduction internal fixation. Obviously, there's different practices, but commonly some patients are kept non-weight bearing for up to 6 weeks, but this could allow for earlier weight bearing. So the results of our study, we found a total of 25 patients, and the age group were between 58 to 93, giving us a mean age group of about 82. Follow-up ranged between 11 to 28 weeks, and most of these patients, by the 28 weeks being the latest date at which the patient was discharged. Of the 25 patients, 1 developed deep infection of the metalwork, which subsequently had to have metalwork removal and then antibiotic suppression. But apart from that, all the other patients had good outcome with no complications. There were no implant failures, and there was no mortality within 30 days of the procedure of these patients. Subsequently, the patients were also interviewed. Of the 25, 21 were able to give responses. The other 4 were unable to, particularly due to cognitive impairment and patients having dementia. So we did both the VAS score and the AOFAS score, and these both were collected and compared. So the VAS score of this patient, the visual assessment score, ranged between 1 to 4, giving us a mean of 2, which mostly told us that the pain was very minimal and the patient was able to tolerate and cope with it very well after the procedure. And the American Orthopedic Foot and Ankle Society score ranged between 58 to 93, a higher score being better, and the mean score of 82, which this score generally looked at things like the function of the limb and the pain, residual pain, if the patient was still not able to cope, and how much function did they regain post-procedure compared to the prior to the injury. And this showed that the mean was about 82, which is also quite good. So for discussion, what we noted was retrograde hindfoot nail shows that it's quite an effective procedure in managing these patients with ankle fractures in the elderly and frail group. because of usually these patients having, as I said earlier, osteoporotic bone and skin condition as well. It's lesser complications, has a low complication rate, and allows earlier return to baseline function and mobility, which would, in the long run, reduce the mortality in these patients. Of course, with our short-term results study, there were a couple of limitations that we need to acknowledge, that this is not a very comprehensive study, but it's still a starting point that could lead to further studies. Obviously, the small sample group, and of course, not having a control group comparison, basically a similar age group of patients that had open reduction internal fixation, and to compare the outcomes directly. These are things that could be done in a further subsequent study, which we are intending on carrying on with. In conclusion, the tibiotalocalcaneal nail has shown to have good outcome in ankle fractures in the elderly due to the fact that it allows for early mobilization, and it also has a low complication rate. Other studies have shown that it's much less, that the open reduction internal fixation has about 4-time complication rate compared to the TTC. However, there is more study that is required, especially with the sample size and also having a control group to further collaborate on this.